All right, y'all, welcome back to Level the Playing Field. I have a very special episode for you today. I have my brother Billy McMullen, UVA NFL alumnus wide receiver, here to sit down and talk. We're going to talk about the unlevel playing field that we see in sports medicine, mental health, and all of the above. So stay tuned, hang on, and we're going to have something great for you. Like and subscribe for more stuff just like this. So like I was saying, Billy, you know, it's an honor to have you on, bro. And
I appreciate you having me.
I mean, look, the people are going to find out, but man, you are an absolute treasure as it pertains to talking about mental health, health equality. And I'd love to hear more. I think they'd love to hear more about how you got, how you made that transition out of playing. And
Yeah,
just
for sure.
one second. So just so y'all know, this is sort of a let's call it a teaser trailer.
Teaser trailer,
Yeah.
Uh-huh.
So in July, we'll be sitting down at the national meeting for the American Orthopedic Sports Medicine Society, AOSSM. We'll be having actually a real detailed conversation about health inequality in sports medicine specifically. And Mr. McMullen's been nice enough to join us for that. It's going to be an incredible event. Hopefully we'll have some details for you, but this is kind of a warm-up or a trailer for that. So sorry, man, go ahead.
Yeah, I think first of all, I appreciate you having me.
Yeah,
and I wish we had cameras at some of our conversations at lunch.
Yes, sir.
Over the phone, through text, because we really dive deep, and I think we hit some pretty good points that other people need to hear. So now we finally got a platform to share that with other folks. So I appreciate you having me, man.
Yeah.
Just in terms of transition.
Yeah, exactly. How did you make the transition career-wise?
Yeah, and that's the thing, man. Guys, we were talking earlier about falling in love with your craft and getting jumpers and putting in the daily habits on a consistent basis, and you fall in love with that. That becomes you. That sort of becomes your identity.
Right. That's
what you're known as. That's what you identify yourself as. And as a football player, any guy that plays sports, baseball, basketball, soccer, you start from an early age normally, and you put that work in every day. Everything is almost surrounded around that sport. And so from me, I started playing organized football as in sixth grade, which I think you're 8, 9, 10 in that range.
Yeah.
And so from 10 years old to 30, that's your passion, that's your love, that's what you're doing, and everything else is part of the journey in terms of school and relationships. But when it's over, it's over.
Right.
And it's not a practice where you could continue to do it. It's not like an entrepreneur venture. When the NFL says it's over for you, it's over.
I got you.
And granted, some new leagues that are coming up, which are good, but if you have any aspirations about yourself, you want to be on that top level. So when I hit 30, and my last team that I was officially with, was the Detroit Lions. That was it for me, 2009. So 29, 30 years old. And it was tough. So I don't care, from LeBron James, when he ever decides to retire, to knowing that guy another 10 years, right? All the way down to the person who never shot a ball in the game or caught a pass in the game or even hit a ball. It's tough because you put so much time in between it. And it was a rough transition for me, because it's almost like the lights off, the crowd is not cheering. You gave thought to things you want to do, but now it's time to do them. I had a young family at the time, and now I have to figure out what's next.
Right.
And you look for things that you're super passionate about, but sometimes they're not staring you back in your face. So I went through a period where I was, which I know now, I was in a depression. Like, football's over. What do I do now? I can't find anything that I'm as passionate about, that I want to put those reps in on every day. 95. Who wants to do it?
Just couldn't see it.
I couldn't see it, man. So 95, you just couldn't see it. So it was a tough transition. It was a tough transition mentally. And guys know that when you're not mentally ready to give it up, it's not going anywhere. So you'll still train, you'll still practice, you probably stay around the game. And that's why a lot of guys get into coaching, because it's the closest thing they can get to the field. But I didn't want to coach.
Okay.
I didn't really want to coach like that, in terms of traveling city to city. But it was a tough transition.
Yeah. Did you feel like you were given the tools, or did you have mentors who helped you provide those tools to make that transition?
That's a great point. So what you see now is not what I was. I was not a socialite. I wasn't a guy that liked to share about my pain points and my I didn't like being vulnerable. So my mentors at the time, they had never experienced what I experienced.
Okay.
I trusted them, still do trust them. But they never experienced being at a high level in sports and then it being over. So they gave me sound life advice, but they couldn't help me through some other things in my life. And at that point, I really wasn't reaching out. I didn't reach out, and I wasn't even really reaching out for tools and those who were in position to help. Now, at that point, as far as the NFL, the tools were pretty good.
Okay.
They were better than nothing. And we just had to search for them. You know, had to search for them. Wasn't, in my mind, it wasn't really readily available to us. Like we were used to things being readily available to us. So that's once again get back to the mental part. But the tools, some tools were there, but I wasn't in a position to seek those tools out. And then when I got the tools, I didn't know how to use them. And I think a lot of guys were in that position too, more than none. Even guys that were not as reserved as I was. The tools are there, but we just didn't know how to use them. And at that point, you got to remember, this is 2009. Mental health was just starting to creep in a little bit. That wasn't a big thing like, hey man, sure, be vulnerable, open up, tell us what's going on. Heck no.
Yeah.
You will not know what's going on with me.
That was the culture.
That was not the culture.
I see.
So, and I think the tools start growing as the culture of mental health and being vulnerable and sharing your story grew.
I see.
Yeah.
A large part of what we're going to talk about in July has to do with inequality, right, and access to care. And the largest, I would say, overlooked portion of sports medicine is the mental health component.
I agree.
And it's it's fortuitous that it's May, it's Mental Health Awareness Month. We're talking about this. Looking at the studies, you'll even see that one of the biggest factors to not return from a sports injury is actually mental health, more so than physical. And we see that disconnect all along the path. You mentioned, sixth grade all the way up to age 30. At every point in time, we see that disconnect. And really trying to see what we need to do to level that playing field. Not to use the brand too often.
That was good.
All right, yeah, I got to sneak it in here and there.
But the wink and the gun,
right? But to see that everyone gets equitable care,
right?
Equitable care. So where have you seen the gaps? You've seen it from an internal perspective, being, your own experience, and you've been a mentor to many others, young people coming up. Where have you seen the gaps?
Well, let's just go back to the past, right? So I had an experience where I had the taste of the county, the taste of the city. My roots run in one of the biggest projects in Richmond, Virginia, where my father grew up, and where my grandmother lived, and where we went to school at. And that disparity is, especially back then, this is back in 89, 88, that was a huge disparity in terms of what was provided. Now, things are, I'm not going to say better, but there are more tools and more availability out there for that. But even in that, as I moved through high school and college, I should say high school, middle school, high school, just the way some of the care and some of the options were for us at a predominantly Black school were not as the same, not taken care as well as some of the schools that were predominantly white in the area. And I think we were talking about this earlier. One of the good jobs that you do is you allow your potential patient to share where they are mentally about their injury.
Right.
The key word is about their injury.
That's right.
You said you may know what's going on, maybe ACL, PCL, MCL, something's going on. That's why you're here. That's why your knee's swollen.
That's right.
I know something, but I really don't know what you're going through and what's at stake.
Yeah.
That's huge, right? And if we're just talking about it from a mental perspective, that's the biggest piece, because that's what's going to get you back.
Right.
That's going to keep you pushing forward. So I think when guys, especially high school, were not given that opportunity to say, hey, listen, man, like, what can we do to get this right? And here's what I got at stake. I got a scholarship on the table. I can't lose out on this because my mom just lost her job. This is what I got going at home.
Right.
Who's here the schools that are looking at me. Here's what's going on. And now the provider gets a chance to say, all right, two things just happened. I'm no longer telling you what I'm going to do.
Mm-hmm.
I'm listening and you're steering the ship, like you said.
That's correct. Yep, that's correct.
Now it becomes a partnership.
Yep.
And you become a consultant, like you said. Now you have the expertise, or the doctor or provider has the expertise, but now it's a partnership alongside with that patient. Like, I know you, you know me.
Right.
I have a better outlook of who you are, and I'm working on a human.
That's right. That's right.
I'm not working on a machine now.
Yeah.
This is not just a check the box. I got 3 knee surgeries this week. No, I worked on Billy, worked on Travis, and I worked on Jasmine.
That's right.
These are people that all need my help. So that part is, I think, mentally for the provider and also the patient. That's the mental portion of it. Like, oh, they know who I am. They not only know who I am, they care what I got going on. And for the providers, like, okay, I'm approaching this totally different.
That's right.
Right. This is something that I'm passionate about and I've done for a long time, but now this is a person, and every step of the way, I'm patient first in my mind.
Right.
And not just numbers.
That's right.
And that's huge.
Right. That's the key.
That's huge.
I want to dial down on something you said about consultation and consultants. One of the big keys here at the show is that a physician is not steering the ship, like you said, is the consultant. With any consultant, a consultant has multiple hats, right? A consultant needs to be able to hear you where you're at, empathetic. They need to be a teacher. They should be teaching you what's going on.
I agree.
Right. And I know you have experience in the financial space, right? So if you went to a consultation with a financial advisor, right? It's in your best interest to walk in with some background knowledge.
For sure.
Right. How do you may not be an expert in the given, field, but how do you assess if someone's treating you fairly or treating you correctly or giving you good advice?
That's a great question, man. Great advice and treated fairly, totally different things. If you don't know, you don't know.
Right.
So you don't know if this advice is good or not.
Right.
Right. You're just hoping, basically, if that consultant, based maybe it's a referral.
Yeah.
That my friend had enough wherewithal to know something, to know this guy can help me, or this person can help me, this woman can help me.
Right. Right.
In terms of treating fairly, is the initial. I'm an energetic person.
Yeah.
Right. I think we all have some type of, like, we call it vibe. The initial vibe is like, I think this person's not really trying to rush me along. I think they're giving me a little bit of time here to see what's really going on.
Right.
They're not talking over me. They're not saying, yeah, my last patient had that issue. I know what it is. Like, they're hearing me out.
That's right.
That's the first stage of treating. Do you hear me, Mr. Consultant?
That's right.
You're supposed to be listening to me. Like, I come to you for help, but you got to know my story.
Right.
And I think one of the biggest disparities that doctors and providers and consultants as a whole, like we just talking about consultants, is they miss the story. Because they're thinking about how to execute on something.
That's right.
You don't even know the story yet.
That's right.
Like, it may look similar to something that you just executed on, a surgeon or a portfolio or something. I should say a surgery or portfolio or whatever you consult on.
Right.
But you missed the whole story.
Yep.
It shouldn't be cookie cutter. And what I've learned through health disparity, financial disparity, is about story.
Yeah.
And the story is a connective point. Because if you really listen to someone's story, you'll quickly identify something that whether it's a family member or friend, that is similar to that person's story, no matter what the background is.
Yeah.
Oh, you're listening, you may not say anything like, wow, my daughter, they just went through that. Or, wow, I remember my uncle, he had the same similar situation. And the uncle may have been a millionaire, and this guy that's talking may have got a couple of nickels to rub together. But it's like, oh, okay. So now you don't see him as a face, you see him as an uncle, or you see him as a brother.
Right. That's right.
He's now, like I said earlier, he's a partner. So that's the biggest thing. Like, if providers and consultants are able to sit back and relax, take a deep breath, let me hear your story.
Right.
Now I know providers gotta see X amount of patients.
Some of that.
Yeah. So you're the consultant, so you still can direct, but treat me fairly by at least hearing me out on my story. Because I may not want to work with you.
Yeah.
Or you may not want to work with me. That's fair, but at least hear my story.
Yeah.
And I think I've learned, whatever setting I'm in, whatever place I am, between millionaires and people that are just trying to make it, the biggest thing is when people hear your story, they're like, wow, instant connection. Bang.
Yeah.
And disparities, I should say, is an open door to start pushing those disparities back, or those preconceived notions about
That's right.
who this person is.
Yeah.
Right.
Yeah. No, I think that's true on an individual basis.
Yeah.
Right. So seeing somewhere where they're at or meeting them where they're at, right, in terms of their care, but then understanding societal forces as well. Right. So if you heard enough individual stories, you start to see the trends.
That's a good point.
Okay, well, the students from this school, they don't have the same preventative measures that the students from this school I'm noticing. I'm seeing more injuries coming out of here. And they're telling me that, you know, the kids are coming in with their parents and saying, hey, Doc, I'm concerned about the helmets and I'm concerned about the turf and the equipment's not good, right? With each individual story, you're building a database, right?
Good point.
Or we really should be, right? Building a database to really assess, you know, equity and care. Now, I keep going back to the financial space because I know you have expertise in that, but also I think it parallels a lot of what we're trying to do here. So I think we've all noticed in recent times there's been a push to kind of more financial awareness. You even see it in like the hip hop culture. You see Jay-Z talking about equity. You see Rick Ross talking about equity. You see young people in college, you know, NIL, the transfer portal has given a lot more kind of mobility, financial and otherwise. And I want to see that same conversation come up around health.
Oh, for sure.
You know, as I mentioned the consultation aspect of things, right? Because just like a lot of these young people, they're going online, they're finding information, and then they're meeting with consultants and saying, hey, you know, I've got some background info. I may not be the expert, at least that's how they should be.
Right.
Come with humility, right? But coming in with some background information so they can then be a full part of the conversation, right? And our goal is to try to provide that same kind of information, right, about health, right? Literally.
You know what's great about that, and also I think is what you're doing is amazing because it sparks conversation. It starts conversation. So if you look at when I got into the league, 2003, the equity conversation, the portfolio conversation in terms of finance, it was cookie cutter. A lot of it was cookie cutter, unless you had some of those bigger contracts where you were handled with more care, right? Because the consultant is going to take his time. Financial consultant is going to take his time because he gets more money, right, from the bigger. Am I right? All right. So you look at it from that standpoint. That conversation wasn't happening,
right?
But over time, people started talking about it, especially in our side of the table in terms of African Americans and people of color.
Right.
Started talking about it, then we started experiencing it, and then we started getting examples to say, oh, we can have that too. What is financial literacy? How do I manage this? How do I manage that? How do I get in that deal? What's my risk tolerance? What's my portfolio size? What's my outlook for retirement, 401k? All of those things matter, right? And those conversations are happening on a daily basis.
Right.
And the people will start executing like, oh, I want to be a part of this.
Right.
What does it take, right? And what's happening now, and I love this because on the health side, that conversation is still very much so in its infancy stage that I think it can grow to.
Absolutely.
Very much infancy stage because you have, like you mentioned earlier, some providers see a preconceived already. This is what this population over here is what I'm getting. Tell me your story. Okay, so here's what we're gonna do. Like, whoa, let me, you know. So what's going on now with podcasts like this is like, oh, I have more information. Right. Now I can come to the table more confident of what I want and how I want it, and then I give it to you how I see it. Now let's partner up to see how you see it. And I may say, you know what, I like that.
Right.
I think that's fair. And in terms of like just the health discussion in itself, don't be afraid. Think about it. Like 2003, 2000, our community, especially in terms of talking about money, was afraid to have these conversations.
Right.
Because the bigger machines were only promoting.
That's right.
These smaller conversations, because you give us $1, we can make $100 off it and give you $1 back.
And you feel like you're doing something.
Yeah, thank you.
Right.
We made, or y'all made, you made X amount of dollars off me, and I only got a small percentage.
Exactly.
But the information is allowed for us to say, oh, that's how you're making your $100.
That's right.
Right. So now if I put it in, granted, this is not no advice, but $1, you don't want to put $1 in, you'll make 100 overnight. I'm just using this as an example, but you say, oh, that's how you made $100 off my dollar. Okay. well, let me figure out how to fix something, put something together, put a group together. We all invest together. We maybe make $50 and maybe only give away 50,
Right.
and we keep the 50.
That's right.
Same thing on the health side.
Exactly.
I'm coming with more information because I watched this podcast.
Right.
I trust the information. I've been studying the information. I'm ailing here. I'm ailing there. Now I know what to talk about, at least to start the conversation. And then it goes back, is this guy treating me right? Or is she treating me right? Because the vibe sure don't feel like this. The vibe really don't feel right.
The vibes are key.
You talking over me. You're looking at me. You're looking through me. You're looking like you knew me before. You never met me.
Right.
You see my hair. You see my face.
Yeah.
You see how I'm dressed a little bit. You know, I told you what school I went to. You already know. Like, I don't think you can help me.
Right.
Or vice versa. I can see you all about me. I know you what you did for my buddy.
Right.
We had great conversations about it. I came with some good information. You didn't downplay it.
Yeah.
You gave consideration to it, and you gave me a plan. So the more information helps with that disparity too.
It's definitely a conversation we need to be having more. Absolutely,
so.
absolutely. And the knowledge, it's empowering, I find. So in July, we're going to talk in detail about this, but there's a specific situation I always go back to and write about. I had a young African-American man, young Black man, high school basketball player, injured his knee, had been told by multiple providers, sprain, go back, rehab it, whatever. Finally, his mother advocated and pushed and said, I want the MRI. MRI showed a full ACL tear, right? And I mean, as many of y'all who follow know, that's one of the most devastating injuries of the knee. I mean, I know you know that, Billy. And so this young man had been playing, on an ACL tear or attempting to for 6 months plus, upward of 6 months, right? And he was complaining. And I think to your point about not hearing the story, so many providers saw him first and didn't hear the story, right? And so this is a studied thing. It's been shown that people from historically underrepresented, served backgrounds, right? Minorities, African Americans, Latino, Latinx, Latina, groups have a longer time from diagnosis to treatment of an ACL, or even a longer time from injury to diagnosis for an ACL. And that's just one sports injury, right? And so if you really think about, kind of the let's call it the inequity in that concept. You were talking earlier about how we, make a certain amount based off, but somebody else is making much more off of it. Right? But look at sports. Look at how sports is influenced by the culture that is largely, has a lot to do with minority culture.
That's right.
Underserved community culture, right? That culture drives sports. And yet at that same time, those same people, that same background of people is not getting the equity they deserve as it pertains to sports health.
You know what? We could talk, and we are talking, I say sports health. And I love the way you connected, because it's very true how sports and music have been our platforms. You can say they haven't, but they have.
Yeah.
In terms of I should say two of our platforms, our major platforms.
Yeah.
And it's elevated us to a place where we have a voice and we can advocate for ourselves, which I love that word. And it's done wonders on the financial side. It's done wonders on different attributes about our culture and how we can promote our culture to other cultures, right?
Right.
But going back to what you're saying is in the infancy stage of on the health side, right? And I have firsthand knowledge of it. I lost my mom about 2 years ago, and I won't say what hospital she was at, but some of the treatment was despicable. It was despicable. And I can't think about another word without cursing on the podcast.
Understood.
It was despicable.
Yeah.
It was just some moments where that's basic healthcare, bro. Like, just do that.
Right.
Or just hear us out.
Just listen.
This is during COVID, so we're screaming through a Zoom.
Okay.
Like, we're on Zoom, like, hey, somebody pick it up. Hey, she doesn't have enough water. Hey, her oxygen tank is out. Hey, some crazy stuff, bro. Like, if I can go into detail, I would.
Yeah.
And it always leads me to believe that two things, and I know that time for nurses and doctors was crazy. Right. But two things, you had to see my mother. You did not see her as a human.
Yeah.
You couldn't have.
Okay.
There's no way possible you could have. Because if you saw your mom laying on the bed, you would have did a better job. You saw a Black woman laying on the bed that you thought was done, and you treated her as such. And it's huge, because they never, and I'm not saying you have to sit with her and have 30-hour conversations with us, but you never saw a human being. You never saw a mother, a sister on that table. You saw a number, and you saw a Black woman. which is I think the biggest key. Now, if it was somebody else, maybe it's a, and I'm not saying, I'm just putting this out there with my experience. Maybe it's a different ethnicity. I think I said it right.
Yeah.
A different race on the table. You may have seen it a little different. So I thought that was the way they responded to her, the way they responded to us. It was tough.
Yeah.
And I can only think that it was something else going on there, and just the care, man. It was low level care. And, you know, we did all we could. And I think one of the things that I learned from that situation is educate. The health system is totally different than you think. The language, the insurance, everything is totally different, right? And then knowing how to advocate properly.
Yeah.
You know, and so that's why I champion what you're doing, because you can't work on 1 million knees in 2 months. There's other surgeons like yourself that are out there that need to close that gap in terms of story and you know, understanding who they're really working with.
Yeah.
And so what you're doing is helping others to be educated about what's going on in their body, so that then they can advocate for themselves, and the provider can see more than just a color or a background. They see a person. They see their aunt. They see their son. They see their brother, and they see their mother, and so on and so forth. And they'll operate and provide care for them in such a way.
Well, I think what needs to change in the conversation around that is this notion of otherness that some people, you know, kind
Good
of
one.
You see what I'm saying? Kind of, I don't know, let's say centralize. We have to see that what happens to any of us happens to all of us. Right?
Good point, bro.
All of us are absolutely connected. Right? And so if populations of our, you know, if people within our population are not being treated adequately, right, the health of the whole population suffers. Every single one of us suffers for that situation, financially, emotionally, physically. In the end, right, we all suffer. We've got to learn to see that we're all connected in this when it comes to healthcare. And that's sports health. What I do, that's any kind of health like you were alluding to. That's mental health, which kind of gives me a nice segue, man. I want you to tell the people about Spark Talk and some details about your program.
Yeah, man. To your point, is it affects the whole chain.
Yes, sir.
No matter the color, it's just what it is. At some point in history, some point in DNA, we all share the same energy. Some point, you know, and I believe that if you see the person for the person, you'll help them as a person.
That's right,
and not a number. I keep going back to that because that's super important. But Spark Talk is a wonderful platform for student athletes. It's a platform based around mental health. And student athletes ranging from middle school all the way up to college. And the platform is a forum for conversation, having conversation around mental health, financial literacy, technology education, relationships, you name it, career development. We're having conversation with student athletes, with pros like myself, former pros, with guys that are current pros, influencers, and also those who are in the community, that we're having conversation with the kids. And I call them kids, but some are, you know, a little further down the line, that these are the things that we would have wanted to have. These are the conversations, some tough conversations that we would have wanted. These are some directions that we would want to have. But the platform is developed for us to have conversations, and then our sponsors and partners to execute on those conversations. So if it's a room, imagine a room full of kids on a Zoom call from around the world that are having conversations about why it's important to make it to the next level, go pro. And the conversation goes from that to, well, I lost my brother, I lost my mother, I lost, you know, how does that affect you in your daily habits? How does that affect you going pro? We had a wonderful session about 6 months ago where a young lady who plays volleyball, and I won't say her name or her school, but she plays volleyball, and she lost her brother about a week before she accepted a scholarship. And that played on her mentally throughout college. You know, here I am supposed to be overjoyed, right? And I got a funeral coming up for my brother. And she on this session, and it was a session that was virtual. We had kids from Denmark, we had kids from Israel, we had kids from Germany.
This is global. This is worldwide.
This is worldwide.
Oh,
yeah. So we had kids from all over. We had kids from Las Vegas, Virginia, Maryland, North Carolina, Tennessee. What was the other one? Kentucky. So we had kids all over in this group, different languages. Most spoke English, but they had the accent, you know.
Sure.
So we were just having it, and she shared that story, and man, the whole room became super vulnerable. And I said, you know, because she's crying at this point, like it really affected me. And I said, how many of you guys dealing with this pain level, or how many of you guys had lost a loved one? And I told them, I said, I lost my mom. And half the class raised their hand. So you can only imagine some of these kids had never had a chance to really talk about this.
Sure, yeah.
Some hadn't ever expressed it around their peers. But here is a safe space to say, hey, it's okay. And it's okay to not be okay, especially as you pursue your dream.
Right.
And it was so dynamic how the conversation spread from that moment, and how many of the kids started helping each other. How many traded phone numbers, you know, having them connected with each other.
Building real lifelong connection.
Lifelong connection.
Yeah.
So Spark Talk is all about having a conversation and getting these student athletes prepared to be leaders in the community, prepared to be leaders in their field, and to be high standing individuals in everything they do, and very, very emotionally intelligent.
Yeah.
And not afraid to share. And when I say share, I'm not saying oh my gosh, I can't do this, but just be afraid to share. Don't be afraid to share what's going on, so I can get stronger in that area,
right,
and continue to, you know, be the best I can be. It's very powerful.
Yeah, well, I commend you for what you started there. That's incredible.
It's very powerful.
Yeah. So where do you see it growing to? How big do you see it getting?
So we're really we're taking our time on it right now, keeping it small in terms of like 50 to 60 people per group, and maybe a little less than that. Some things I would want to share on here that I can't share just yet, but
sure.
As of right now, we're leaving it as a open forum where these young people can come in and just start with the conversation, and then connect them with the right partner. So if you have some mental issues that you may be working with, we have partners for that. If you have some, you know, you're thinking you want to learn more about an NIL deal that you are interested in, we have financial partners for that. You know, if you're thinking about getting heavier into the tech space, we have some partners for that. And of course, you know, you were one of our partners. So, you know, people who are interested in, like, maybe have a shoulder knee injury, or even thinking about becoming a provider, ortho, we have partners for that. And that's the idea of it, just to have the conversation, connect them, but also enlighten their imagination. Like, wow, it's more than just sports out here. Wow, it's more than me being tough on the field. You know, I can have a real life out here. I don't have to be a robot. So it's amazing, because, and it was sort of birthed out of me and my brothers that have played multiple sports, and this is for female and male athletes playing multiple sports. Me and my brothers, we were like, hey, did y'all have these conversations when you came up in your house? I'm like, no. Did y'all talk about mental health or why you were hurting this? Hey, did y'all even talk about how to balance a checkbook at your house? Like, none of this happened.
Right.
So now we're like, let's have this conversation, and let's gear it towards student athletes.
That I can't contain my excitement, man. That's incredible. The way you brought it full circle, right? Addressing the holes or the gaps that you saw coming through the system, right? And then going back and giving back. We all need to take example from that. And I can't wait to see what it becomes with time. And I can't wait to talk to you more in July.
Oh, for sure.
Yeah.
It's going to be awesome.
It's going to be epic. It's going to be absolutely. So, this was Billy McMullen. I want to thank y'all for watching. Please like and subscribe for more information like this. Thank you, my brother. A blessing always. Yeah. Praise God for the chance to talk to you anytime. So we'll see y'all next time, and y'all stay safe. Take care.